Hello everyone. This is Dr. Raewyn Teirney here, and I'm a fertility specialist that works with IVF Australia. So thank you for coming along tonight. I will be moderating this Facebook Live. The topic is all about fertility and age. So please, if you have questions, I'd be very grateful if you could just type in the questions. Now, we might have a glitch. I just want to let you know that uh, Facebook are having a glitch with questions. So when you put them in, um, they're then going to be coming along through to my phone, so I can then have a look at your question and then I can answer your question. But please, I'd be very grateful if you could put in your questions and then I'll look at them on my phone and then I can answer your questions. But anyway, I'd like to introduce myself. I'm Dr. Raewyn Teirney. I'm a fertility specialist with IVF Australia. I've been helping couples for the past 20 years conceive and have a family. I trained initially in New Zealand and then came here to Australia and worked at Royal Prince Alfred in my training, and then on to Cambridge in England, where I subspecialised further in reproductive medicine and infertility. So I have my CREI, and it's been such a marvellous time helping couples conceive, and I really want to help you guys tonight. So please put in your questions and it will come to the phone. Anyway, I'd like to also mention that Professor Bill Ledger was supposed to be doing the live Facebook tonight, and I apologise he couldn't make it tonight because he had some other emergency issues. So you have me, and I'll be delighted to help you tonight in answering some of your questions around your issues as well. So I think let's just start. The topic is all about aging and infertility, and what does the impact of age have on fertility? Because it does. There is quite a big impact. Just to let you know, let's say hi. So Benazir says hi to Dr. Teirney, and I'd like to say hi as well back to you. Hi to Maria. That's lovely that you're here, and hi to Rebecca. But just about the impact of age and on our fertility. It does impact, just for us women, especially so. Men too, but more so for us women at an earlier age. And it's because that we are born with all the eggs that we'll ever have. So this is how we women have been designed. Our eggs were made in our ovaries when we were still a fetus in our mother's tummy, in a mother's uterus. And so around about the age of 13 weeks is when our eggs start to develop. And by the time we're born, we have about 2 million eggs left in our ovaries. And from birth, those eggs just keep declining over time. So you can imagine that as little girls, when we're running around, playing on the swings, going to kindergarten, our eggs are declining even as little girls. And then by the time that we reach puberty, probably over, 3/4 of our eggs have been depleted and undergone what we call cell death. So at puberty, we may have around about 300 to 400,000 eggs left. And at puberty, we start to ovulate, and every month when we ovulate, probably about another 20 eggs grow with that, however, and they die off. So as we're ovulating one egg each month, us women may have about 10 to 20 eggs that undergo what we call cell death. And this continues on. So even when we're on the contraceptive pill, we're all taught, not to get pregnant. So we go to school, and all the classes and information that we get at school is not to get pregnant too early. And we all talk about contraception. So even on contraception, while we're on the contraceptive pill, our eggs are dying off. So you can imagine this continuous dying off of eggs. And by the time us women are trying to conceive, when we're in our perhaps late 20s or 30s, the eggs are less and less and less, and they're getting older. Now, I have another question on my phone. How long should I try to get pregnant for after the age of 35 before I try fertility treatment? That's a great question. Um, we recommend, and I recommend, that if you're under the age of 35, then the normal chance of trying to get pregnant is around 12 months. And so, under the age of 35, if you're trying to conceive, not to be too worried for the first sort of 6 months or even up to 12 months. However, because of our age and our fertility declining, once you get from 35 and over, we recommend that if you're not pregnant in the first 6 months of trying, you really do need to go and get investigated. And I'd recommend that you go and make an appointment to see your family doctor and then get referred to someone like myself, a fertility specialist. And the reason for that is your fertility declines as you age, and especially after 35. So our fertility declines, but by the time we get to 35, it can decline sharper, and even from 38, chances of conceiving are even less. So we're not very good, as you can imagine, us female humans at reproduction. To give you an idea, what your monthly chances are when it comes to age. Say when you're in your 20s, the monthly chance of getting pregnant would be around about 20% per month. So 20% per month. And then by the time you're about 37, it will drop down to about 15% per month. And by the time you're 40, the chance of a woman conceiving would be around about 10% per month. By the time a woman is age 42, that chance drops down to about 5% per month. And by the time she is 45, it'll be about 1% or 2% per month. So you can see there is a steady decline as we age. So this is a really important concept that you have to understand. If you're trying to conceive and it's not working and you're over the age of 35, then you do need to go and ideally be tested. And the reason is just also for peace of mind, really making sure that there's nothing else going on that could be stopping you from getting pregnant. Um, if you want to ask some questions, please, I'd love you to keep asking questions um, so that I could help you with anything. Just to carry on about age and fertility, and as I said, the monthly chance does decrease as we get older. So when you're in your 20s and early 30s, it's okay to keep on trying for the first 12 months. But even then, if you're not pregnant after 12 months of trying and you're young, then really you also need to be investigated as well. And the kind of tests that we look at, we check to make sure that you're ovulating in a regular fashion. We're making sure that your egg numbers are okay, and I'll delve into that very shortly. We make sure that there's nothing wrong with the uterus, that there are no polyps inside the uterus or fibroids that could be impacting. We check for a condition called Polycystic Ovarian Syndrome, and we check your fallopian tubes as well to make sure that they're open and nice and can capture your egg when you're ovulating. And for your partner, we check his sperm. Now, I do have another question here. I am 35 and I'll be 36 this year. I have had 3 recurring miscarriages. I'm very sorry to hear that. I'm soon going in for a hysteroscopy and a DNC. I have PCOS and male factor, which from slow sperm, and I'm nervous and worried that I will have a healthy and smooth pregnancy. Just to reassure you, yes, you've still got a great chance, okay, of having a healthy and smooth pregnancy. I'm terribly sorry about your miscarriages. And of course, as we age, miscarriage does become more common. Um, Again, this is an age factor and related to our eggs. I think it's a great idea. So, women who are having difficulty getting pregnant or even miscarrying, hysteroscopy is a great test. And this is for everyone who's listening. A hysteroscopy is where us doctors look through into the uterus with a very small camera and we check out to make sure there's no other problems inside the uterus and that you can carry a baby, okay, and that implantation should occur. And we can actually take samples inside the uterus and check the lining to make sure there's no infection or something called natural killer cells that could be activated. I want to just touch on polycystic ovarian syndrome. Uh, just to let you know that most women with this condition called polycystic ovarian syndrome do actually become pregnant naturally, just to reassure you. Um, so PCOS, women often have a lot more eggs. We do find that uh, because of their condition, there may be more androgens that are floating around, and they tend to have infertility related to not ovulating or ovulating infrequently. And the other reason why they may have trouble conceiving is because when you're overweight, we know that weight with PCOS can impact on difficulty with implantation, and of course can also lead to a slight increase in miscarriage. Now I just have another question here on the iPhone, so don't mind me, I'm just having to look at my iPhone all the time because Facebook are having an issue with question time. But I want to just reassure the other woman who's going on 36 that you still have a good chance of conceiving, all right? Don't be nervous, don't be worried. You have a good chance of a healthy and smooth pregnancy. Now, another question is, should women avoid alcohol while trying to get pregnant? And is a glass of wine a night okay? Well, great question. Because we do recommend that if you are trying to get pregnant, ideally you have to reduce your alcohol intake down. You do. We don't know the whole full impact of what the dose should be. How much alcohol are you allowed to have? I actually say to my ladies, look, no more than 5 glasses a week, which is less than 1 glass a night. Um, but the Medical Research and Health Council are sort of indicating that perhaps you should be stopping drinking altogether while trying to conceive. I would certainly be reducing it right down. We don't really know what that dose should be. So at the moment, I'm saying to my ladies, no more than 5 glasses of alcohol a week. And same for men, because alcohol affects men as well in their sperm production. Again, no more than 5 in a week, and certainly not 5 all in one go. Binging does not help with egg quality and sperm quality. Um, but as I said, there is a lot of talk out there that perhaps women should be stopping drinking altogether. Now, I've got some other questions here. So this is another question, do women sometimes not ovulate? Yes, that's right. That is quite a common cause for infertility. I feel there's a couple of times I haven't ovulated. I'm 40. Apparently, I have a low ovarian reserve. Okay, so just a couple of points with that question. So thank you for that. Um, just we'll talk about ovulation to begin with, and then we can talk about low ovarian reserve. Yes, ovulation, not ovulating, can lead to infertility because if you don't know, if you're not ovulating, there's no chance that egg and sperm can meet up to fertilize and create an embryo. And if you're only ovulating very infrequently, which might be only, 2 or 3 times a year, how do you know when to time sexual intercourse and to get that timing right for egg and sperm to meet? And so when there's lack of ovulation, there is actually fertility treatment out there that can help you ovulate more frequently to help you get pregnant. Now, the other issue is age and ovarian reserve. As I mentioned, that we use our eggs up as we age, and so by the time we get into our 40s, we have a much lower ovarian reserve, and it does become harder to get pregnant. And so, as the question, I'm 40, and apparently I have low ovarian reserve. Yes, this is very common. I see this all the time in my clinical practice. When you're 40 years of age, just as for all you women out there, okay, who's listening now live, and even who might be listening later, female age is one of the most important factors in trying to conceive. If you're struggling and you're that little bit older, then you need to take action and be proactive and go and see a fertility specialist and get tested. And the reason for that is there is only a very short window left when it comes to the chances of getting pregnant. And just with your 40 years of age, that window might only be 18 months or a couple of years at the most. So you would need to be more proactive in trying to get pregnant rather than just sort of waiting it out. And I would certainly recommend for that, with a low ovarian reserve, to go and see a fertility specialist. Um, I have another question here. Do you only help couples? No, and in fact, all of us fertility doctors um, help a variety of people. And so here at IVF Australia, and with including myself, not only do we help couples, we help same-sex couples, we help single women who might be wanting to conceive and want to know what their fertility is. We can even help men as well. So it's not just couples that we help, it's a real variety. And if you want to know more information, then certainly get onto our 1-800 number and make an appointment. Just regarding fertility and aging and helping um, single people get pregnant or even putting fertility on ice, we actually do quite a lot of egg freezing as well. So if you're you're a single person and you don't have that opportunity at the moment to be a mother, or you're not with a partner at the moment and you're worried that you're getting older, then certainly the idea of freezing your eggs is actually an option that you should consider. I actually am telling all my nieces who are in their early 30s to freeze their eggs because they're single at the moment, and I don't, ladies all know who you are, and I don't want them to miss out on motherhood either. So egg freezing is a very good option for women who are considering motherhood but don't either have that opportunity yet, but you can freeze your eggs. Now look, I've got a few other questions here. Another question, and it's always good to talk about out the question because you may have the same sort of thoughts. PGT, this is pre-genetic testing, PGT. Does it damage the embryo? And would you recommend getting this done for those over the age of 40? So PGD, just to let you all know, is called pre-gestational diagnosis testing, and this is where you undergo IVF, and eggs are removed and fertilized with sperm, and an embryo is created. And then once we create the embryo and grow it for 5 days, we get it to a stage where we could possibly take some cells out of that embryo and test it for all the chromosomes to see if there is a genetic abnormality or a genetic problem within that embryo prior to implanting that embryo. Does it potentially damage the embryo? The answer is yes, potentially it could damage the embryo. Now, we've been doing this at IVF Australia for a very long time. Our scientists are exceptional at doing this. Chances of damaging an embryo are extremely low. They are, but yes, there is always that potential that you could do a little bit of harm to that embryo and it may not survive on the thawing. However, it is still a very useful technique for couples who are having difficulty getting pregnant or have had a lot of failed IVF. So if you're someone who has undergone IVF and had what we call failed implantation, so you've had embryos go into the uterus and they haven't implanted, then certainly PGT testing of those embryos would be a recommendation that I would recommend. Another reason for doing PGT testing is yes, as women and couples get older who are undergoing IVF, just say you're 42, the chance of the embryo being genetically abnormal does become higher. And what we know in all the studies is that of the embryos that are made, probably about 70% of those embryos are genetically abnormal. And so testing of the chromosomes in those embryos prior to implantation would certainly at least exclude those embryos that were abnormal, and then we would put a very normal embryo into the uterus, and that would increase those chances of you getting pregnant. And obviously, not giving couples false hope that we're putting an embryo in and it will implant. So do I recommend PGT testing? Yes, I do. for couples who are older and for couples or people where there's been what we call implantation failure. And the other scenario is if you're carrying an abnormal balance translocation, or you might be carrying a gene that could affect your offspring, like Huntington's disease or whatever. We do recommend PGT testing then. I've got some more questions here, so let me have a little read here. I've got a question here. Hi, I'm 42. I've had 2 failed ICSI cycles made up of 5 failed transfers. I've had 1 chemical pregnancy. Hysteroscopy is all normal. What are your thoughts of ERA testing? Great question. I'm very sorry that it hasn't worked for you yet. So you've had 5 embryos that have gone back and they've all failed to implant. What I'm not sure of is if you've had any genetic testing of those embryos. What are your thoughts of the ERA testing? Just to let everyone understand what that means, the ERA test is a test where we look inside the uterus. We can actually take some samples of the lining around a certain time in your menstrual cycle, and these cells get then sent to Spain, where they're tested to see if they're at the right stage for implantation of an embryo. Is it worthwhile? Well, I mean, you have had 5 failed embryo transfers. I would certainly be recommending doing PGT testing first over doing the ERA testing. However, if you've had the ERA testing and you're still having, if you've had the PGT testing and your embryos are genetically normal, and you haven't got pregnant, then yes, ERA testing would be appropriate then. That's what I'd be recommending. But you do need to talk to your doctor, your situation, and your fertility specialist would know your whole story. And I would actually take the advice of what your fertility specialist is recommending. So it may be worthwhile doing that depending on what your situation. I don't know your whole situation, but this is what an ERA test is. I've got another question here. I'm 40 with a history of miscarriage, very sorry, and no live birth, PCOS and MTHFR. So this is a condition where you may be carrying, having an enzyme that can increase the risk of something like a miscarriage, or where you may be at risk of a neural tube defect in the pregnancy. Is there something specific I can do or should do for the MTHFR? I hear so many different opinions of this. Thank you for that question. Yes, firstly, your age of 40 will impact on chances of getting pregnant. And yes, as we women get older, miscarriage rates do go up. Having the MTHFR gene, if you have 2 abnormal genes, then it does put you at increased risk of a miscarriage. There have been some very good studies that show that increasing your folate levels will certainly help reduce that risk. Now, uh, the recommendation, and this is from the World Health Organization, and this is from the NIH in America, and the NICE trials in the UK, that women who have this condition with the MTHFR should go on high dose folic acid. But all you ladies should be on folic acid anyway. Anyone who's trying to get pregnant needs to be on folic acid. The minimum dose is about 500 micrograms per day. But if you have this MTHFR mutation, then you need to increase your folic acid up to 5 milligrams per day. You can get this in any pharmacy and ask for something called Megafol. Some women go on a specific nutrient called folinic acid, and certainly that can help. The only issue with folinic acid is all the studies have been done on folic acid and not folinic acid. Also, folinic acid is very unstable, whereas folic acid, which is the vitamin B group, is a very stable vitamin. So I would be recommending trying 5 milligrams of the Megafol, which you can get in any pharmacy. Um, Let's have a look. I've got some other questions here. I'm 35 next month and I've suffered a miscarriage. Should I be worried about a second miscarriage next time, being 35 in a couple of weeks? Very good question. Um, just to give you an idea, for any pregnancy, um, around about the age of 35 and under, the chance of any pregnancy being going on to a miscarriage is around about 20%. So with your next pregnancy, we do know, and the studies have shown that your chance of a miscarriage second time round again is 20%. And for a third miscarriage, it's a little bit higher, maybe about 25%. Um, so next time around, no, your chances won't be higher if you've already had one miscarriage. I'm very sorry for your loss, but don't be worried about a second miscarriage next time. And I'll just keep on trying, all right? Things that we can do would be watch you a little bit more closely in your very early pregnancy. I've got another question here. I'm sorry, I'm just looking at my phone here for all the questions. Thank you, guys. You're sending in lovely questions. One is there any way, either medically or through lifestyle changes, to slow the decline of a woman's fertility? Gosh, I get asked that question all the time. Medically or through lifestyle? Well, certainly, let's go on to lifestyle first. We know that there are certain lifestyle factors that will affect your fertility decline and make your fertility decline even quicker. And what we do know is that smoking will actually knock off your eggs quicker, so deplete your eggs quicker, as well as affect the quality of your eggs. So definitely that lifestyle of smoking. Yes, alcohol will have an impact on your fertility as well. Um, in terms of your um, food intake, we know that for food, things like foods that are high in saturated fats, pies and chips and crisps, soft drinks, all will have an impact on egg quality as well. And so changing your lifestyle to that really healthy lifestyle, having a diet that's rich in antioxidants, eating all those leafy green vegetables, broccoli, salads are all very good, we know. Um, so it's the kind of lifestyle that reduces what we call all those free radicals, because we understand that free radicals that you get from smoking and alcohol and poor diet that affect eggs. So it's those free radicals, that those nasty molecules that will affect your fertility. So yes, changing lifestyle is really important. That's a great question. Is there something that you can do medically to reduce your egg decline? For some reason, we have this time cell death in our ovaries. And so poor lifestyle will increase that time cell death, but is there anything that we can do to slow down that timed cell death of our eggs inside our ovary? Look, there are many sort of factors have been put forward. So things like zinc, folic acid, garlic, all these sort of antioxidant type supplements, um, selenium, lycopene, which we can get in tomatoes, are all thought to have possibly a benefit, but nothing's been proven yet. All right, so I don't think it will do any harm. There's also a theory around coenzyme Q10 that may be a benefit to eggs as well. As a medical type treatment. Now, what we do know in animal studies is that the vitamin biotin, which is NAD, is supposed to improve egg quality and possibly reduce the decline of eggs. The problem is we see it in mice, but it's very hard to translate into humans at the moment. But I think watch this space. Look, I've got some more questions floating in here on my phone. Let's have a look. This is a very good question that I'm always asked frequently. I had a miscarriage last year and one failed IVF cycle this year. I'm very sorry that you had this happen. The embryo was a good grade but failed to implant. Are there any tests that you would recommend? Yes, certainly. For couples where there may be, persistent miscarriages or failed implantation, sort of tests that I would be recommending, and speak to your own doctor about this, of course, because they know your own situation. But the sort of tests that I would put my people through, would be, there are special recurrent miscarriage tests that we do. So we'll be looking at your own genetics for you and your partner. There are what we call thrombophilia tests that we look at, which are special molecules that could increase that risk of miscarriage, and we would test you for that. These are things like lupus and anticardiolipin antibody, the MTHFR mutation that I was talking about earlier. I'll be testing you for that as well. Other tests would be having a check inside your uterus. So this is a hysteroscopy where we can look through with a little camera, check the inside of the cavity of your uterus, check the lining. We can check the lining for things like infection, check for polyps or anything else that could stop an embryo from implanting as well. Other factors are, we could look at your partner's sperm. Sometimes, don't forget, it takes two to tango, and men are half the equation. And so it could be that your partner may have sperm issues, and I'd be checking the DNA fragmentation in the sperm if that hasn't been done already. But these are factors that you need to obviously go back to your own doctor to discuss. But yes, there are tests, further tests that you can do prior to doing any more IVF. Don't give up, all right? I do recommend carrying on and stay the course, all right? Got another question here. I had a failed transfer via IVF in June. I'm sorry about that. That is heartbreaking. We were told to try naturally in July. We fell pregnant but miscarried. Well, sorry, that's terrible. Do I continue with IVF or continue to try naturally? Good question. Um, It depends on your whole situation. I don't know your whole scenario. Do you keep on trying naturally for a little bit longer, or do you go back to IVF? I suppose it depends on the reasons why you did IVF in the first place. This is how you look at IVF. IVF is all about increasing your chance of getting pregnant. So when I see couples and I look at all the test results, and looking at the age of the woman, so looking at that time left to conceive, looking at what the factors are there factors that will be reducing your chances of getting pregnant? If there are factors that are reducing your odds of getting pregnant, then IVF would increase your chances of getting pregnant over that. So I think the biggest factor would be your age. So if you're someone over the age of 37 or 38, and you're trying to conceive and you've failed at your first IVF, then I think time-wise, then I would be looking at going back to IVF. But if you're someone who's a lot younger and you could probably have a bit more time trying to conceive, then I think trying naturally for another month or two would be very appropriate. Remember, it's all about age and the amount of time left in trying to conceive, because female age is extremely important when it comes to getting pregnant. There are many fertility treatments out there. IVF is the biggest bang for your buck, I suppose you could say. When it comes to getting pregnant, it's all about what treatment gives you the biggest chances of conceiving. If you're a 30-year-old woman and you're trying naturally, then it may be that after 2 years of trying, your chances may now be only 4 to 5%. If you go and do IVF and you're a 30-year-old woman, your chance of getting pregnant per embryo would be about 40 to 45%. So you're increasing your chance fourfold by doing IVF. But I suppose it depends on where you are in your age would be the factor that would decide that. So look, go back and speak to your doctor. They'll give you some good advice around that as well. I've just got a question here. Someone's just mentioned, can we take 2 Elevate pills a day? I've started taking Elevate today and I'll be doing IVF in a couple of weeks. Well, look, no, you can't take 2 Elevate tablets a day. Just read the directions on the packet. So anyone who's taking vitamins, read the instructions on your packet. all women need to be on a prenatal supplement, and it should be folic acid and iodine and iron. Um, but you should only be taking one a day, not two a day. And the reason for that is not just Elevate, but other vitamin companies as well have special ingredients in there. And if you double your tablet, you could be getting toxic with certain substances. And I know Elevate has a very, very high iron, and so you shouldn't be taking double of the Elevate. Just take one a day. That should be enough for you. And I really wish you all the best for doing your IVF in a couple of weeks. Thank you, Sarah, for your comment. What should we do to recover after a miscarriage? That's a great question. I'm not sure if that was you, Sarah, but look, it's really heartbreaking having a miscarriage. It is, you've gone through, you've probably either done fertility treatment or you've had this hope and you get pregnant and you're excited and then obviously it doesn't happen and you go on and miscarry. Grieving's really important, and let yourself have a cry. All right. How long should you recover? You don't need to recover for long. All right. Once upon a time, we used to say to women, look, go away for 3 months after your miscarriage, and let your uterus settle down. But that you don't have to do that at all. You can really just wait 1 month after a miscarriage to then start again. But it's really about how you're feeling inside. I'm always telling my ladies, look, go and to spend some really lovely time with your partner, and when you're ready to go back. So if you want to go back and try again a month later, that's okay. If you want to go back and try a couple of months later, that's okay. If you need more time, that's fine too, okay? It doesn't really matter. But you don't need to wait out 6 months in between trying for a baby. All right, I hope that answers your question. Any other questions? I'm going to be wrapping up very shortly, guys. So just I'll answer another question if you want to put in any more questions. Someone has asked here, could you please explain what a long down regulation cycle is? I'm about to start this after 2 failed shorter cycles. Thank you for that question. There are various ways of doing IVF. When we first started out with IVF, we used to use a protocol called the long down regulation protocol. And long down regulation is where we're trying to suppress your ovary first. So we suppress the ovary and make it really quiet. And once it's quiet, then we can come in and take over your ovary and give you the hormone injections to then grow your eggs and take your eggs out. And to quieten the ovary down, we use what's called the long protocol. And we're giving you medication, usually in the form of either a nasal spray called Cineral or an injection called Lucrum. And it's this medication that quietens the ovary down. And it takes a bit longer. So this is a much longer IVF cycle. So instead of being 4 weeks, it would be 6 weeks. And we often do this sort of cycle in women who may have endometriosis. We sometimes do the cycle in women with polycystic ovarian syndrome, or we might even try the cycle in scenarios where other cycles have failed, and we say, well, let's just try something a little bit different to see if we get a better response from the ovary. The shorter cycles, which we tend to do now in IVF, are called the Antagonist Protocol, and this is where it's much shorter. You're only on 2 weeks of hormone injections to grow your eggs. The ovaries aren't completely quiet. We just start on the first day of your menstrual period and grow your eggs and then take your eggs out. So I hope that explains about the long down regulation cycle. I have another question. Is this is from Instagram actually. Is intrauterine insemination, we call that IUI, possible in Sydney if the husband lives in Queensland for work? Can sperm be shipped? The answer to that is yes. Look, it is possible. Intrauterine insemination is another very good treatment where people just can't get together. We see this quite often, especially people who might be in the Navy or Air Force and can't be together, where one partner might be living in one state and another partner in the other state. And so, yes, we can do intrauterine insemination. If your partner is living in a different state, it does require him seeing a fertility specialist uh, and going through certain tests. We would need to check the sperm. You would, as a couple, need to see, and at the moment, because of coronavirus, we would be doing telehealth if that was the case, as a couple, and interviewing and taking a medical history and looking to see if that was possible. But yes, that is possible. So look, I'm going to wrap it up from here. Thank you so much for your wonderful questions. I really wish you all well, and I wish you a positive pregnancy in the near future. So I'm going to end the live video now. Thank you very much.